Good evening, everyone. Welcome to The Upside. My name is Jonathan Oleski with JMOR, and our show is about to begin tonight. To maximize your experience, we recommend putting your Zoom screen on speaker view. Now it is my pleasure to introduce two wonderful co-hosts, Beth Goldsmith, Chair-elect of the Associated Jewish Federation of Baltimore, and Dr. Scott Rifkin, publisher of JMOR. Scott?
Hi there. Welcome to The Upside. This is our second virtual show, and the first show was amazing. We had hundreds of people tune in. Is that amazing? You know, given some promotion by the Associated, promotion by JMOR, we had hundreds of people tune in, and then hundreds more listen to the show on Facebook and such later. It's really wonderful. The show is, as you know, is brought to you by the Associated Jewish Federation of Baltimore and JMOR Magazine. And the intention is to keep the community informed that during the pandemic and during the isolation, everybody keeps saying this time of uncertainty. I've heard that so many times on so many commercials. I don't want to keep saying that. But during this pandemic, we're going to do our best to keep you tuned into what our community is doing, how we're sticking together as a group, and the resources and the fun things too that we can be doing with our families. So Beth, it's all yours.
Thanks, Scott. Yes, we will be coming to you twice a week with episodes you can view live on Zoom, Facebook, and YouTube. Each episode will feature a new expert who will enlighten us about the questions you've probably been asking during this crisis. You can submit questions in advance or use the chat feature in Zoom. Both the Associated and JMOR are committed to keeping our community safe, educated, and together during this time, and we hope this show is one way we can continue to do this. Of course, we both continue our core business. The Associated and its agencies are on the front line, addressing the economic and social needs of our community at this pivotal point in our 100-year history. We hope you continue to stay connected with us as we support the most vulnerable in the community who need us most.
Thank you, Beth. Thank you. JMOR remains committed to bringing you the news and the stories of our community in print and online. You can still get the magazine in print. It's in lots of places. You feel free to dip it in alcohol or spray it or light it on fire or whatever you need to do to feel safe. We don't mind. We're not offended. And then all the content is also available online. And our folks are even busier than ever putting more and more content online and trying to make sure that everybody's up to date with everything. I'm really pleased to introduce a friend and somebody that I've gotten to know very well over the years and just a good guy, Marc Terrill. Marc is the president of the Associated Jewish Federation of Baltimore. The Associated, our network of organizations that provides for the needs of Jewish Baltimore, is on the front lines of responding to this pandemic and has had to adjust in the face of crisis. Marc can share his insights on how our community is responding and adjusting. Marc, welcome and thanks for being here.
Thanks, Scott, and thanks, Beth. I'm glad to be here, and it's fabulous to see everybody's faces. Thank you.
And it's always great to see you, Marc. So let's start at the beginning. Tell us about life at the Associated pre-COVID. What was on the docket for the system?
Well, thanks for the question. I think life was pretty good at the Associated. And when I speak about the Associated, I'm really talking about the Associated and our network of agencies. So to put it into a context, it was, I say it was good, but it was obviously fraught with a lot of complications and difficulties. Even though pre-COVID, there was reference to an economic recovery, most of our community really didn't see the benefit of an economic recovery. As a matter of fact, 1 in 3 in Jewish Baltimore were receiving some type of subsidy from our system. So obviously that is a challenge. Another area of concentration that we were focused in on had to do with the evolving social service needs and modalities, as well as new ways that we were bringing content to Jewish experientials and identity building. And really the last area is building connections to Israel and Israel-based education. So on all fronts, things were really moving quite well, and then COVID happened.
And I
So-
know we were about to celebrate, really celebrate with the community, our centennial, our 100 years of existence. What happens to those plans?
Well, let me put that into a context too, and you guys can interrupt and let me know when you want to interject questions. But in terms for everybody's information, the associated system was born in 1920. We were in the 100th year anniversary, the centennial, which actually, even though started in 2020, really the planning started in earnest 4 years ago. We had formed committees, both professional and volunteer, to look at trends, to look at best practices, to look at a number of different things of how we wanted to craft product for the next 100 years. It was an incredibly dynamic process, and a lot of incredible things came as a result of it. And about a year ago, we started in earnest, as you, Beth Goldsmith, know, raising money in order to realize the dream. Because in order to have these new programs and projects, it cost money. It was going to have to be funded. And in a year, we raised a little over $100 million in order to fund our $200 million campaign. And then COVID happened. So your question, Beth, about what happens now with those projects, they're hardly going to be shuttered. We need to have these different projects in place. They've been evaluated, they've been discussed, they've been vetted for its impact potentially that it will have on our community. However, time and scale may be readjusted. So that's really what we're grappling with right now.
So, Mark, I have a lot of questions to ask you, but I actually want to start with something very simple. How are you and your family doing? How are you guys on a personal level adjusting to all of this?
There's a deep sigh there. It's been difficult because of proximity. Well, it's fabulous. One of the blessings of this is that I get to have my family with me 24/7. We're able to have dinner for the most part together. Everybody's working hard. I have a 24-year-old and twins who are 17. They're engaged in school. My 24-year-old is working on different projects. Everybody's busy. My wife is a therapist, and she's running sessions out of her office in the house. So it's been very busy. Now, that said, it's also been difficult in that, as everybody's dealing with, it's the rigors of kind of like Groundhog's Day, that it's as a matter of fact, I don't even sometimes know what day it is. And it's the only time I do know what day it is on Shabbos, because there I have essentially a 24-hour reprieve to regenerate. But we're doing fine, and thank you for asking, Scott.
Yeah,
I'm going to jump in there. I'm sorry, Scott.
No, go ahead, please.
I was going to jump in there with, yes, except for Saturdays. I would say I speak to Mark almost every single day. That's part of the Associated Lay professional structure. And as incoming chair and Mark as president, we are very much involved in this together. And speaking of that structure, Mark, we are unique in Baltimore. The Associated does have a different structure relative to other communities. Can you explain that a little bit to our viewers, listeners, and maybe tell us how that has worked during this crisis?
Sure. So just for clarification's sake for everybody, in every community, they have a structure. And that from the beginning of the formation of federations throughout North America, actually the first one was in Boston, Massachusetts, some smart people got together and said, listen, we're stronger together as a collective than having competing entities that aren't coordinated in any way. And the first federation was born. the Associated in 1920. Since that time, some communities have shed the discipline of working in a coordinated way. We, as you know, in Jewish Baltimore, the Associated has the Associated Annual Campaign, which is really the principal economic engine that empowers our agencies to perform the miracles they do. Another important feature is that in addition to fundraising together, we plan together. So our structure of dampening and eliminating competition, weeding out redundancy, fostering collaboration, even though it makes perfect sense from a social service delivery standpoint and also from a business standpoint, many communities don't do it. So our strength, arguably the most important thing we have in our arsenal, including leadership, both lay and professional, is the way we're structured. And Beth, if I can, I guess if for the listeners, I could take it to a practical standpoint. In 2008, when we were on the verge of an economic abyss, we were able, the Associated with the agencies, to pull everybody together and talk about highest and best use of Jewish philanthropy, how we coordinate, and how we take care of the community. Now, in 2020, we have COVID. And similarly, we were able to pivot and make sure that we were addressing the things that needed to be addressed now.
That's great. Can you run through sort of, I mean, as I said, I sort of was in on this, but I know we like to say, and I think you always say, that we are here for this kind of an emergency because we're here every day, because we were there and prepared. Can you run through real quickly the timeline of what actually happened in the last few weeks?
Yes, like everybody, as a matter of fact, Scott, I think I spoke to you a little before COVID, and it was business as usual, obviously. And then we started to hear about this virus that was in China. And then it started to become a little bit more. It wasn't going to be, it wasn't seen as a common cold. It was something that was going to be more severe. And then we consulted with medical experts, a lot of people at LifeBridge and others. And then when we saw that this was not going to be something that was going to be small and it had huge consequences, we convened, I and Debs Weinberg, who is our chair of the board, appropriate top leadership of the community, and the agency executives. I must tell you, we have 12 local agencies, in total, 25 different programs that are working on issues from cradle to grave. And I can tell you, these are some of the most talented human beings that I've ever had the privilege of working with, both volunteer and professional. We convened, just like in '08, and we talked about what we needed to do. And essentially, right after that, we moved the workforce, about 1,100 employees, remotely. After that, we developed a communications plan, because what we needed to have was a communications plan for community leaders, for staff, for people who needed help, for agency executives, and we routinized that. We also had to have access points for people to be able to get help that they needed. And then, of course, we needed to have a mechanism for continually collecting data, because that was informing our strategy as we were going forward. And these high-level groups continue to operate today. As a matter of fact, we have one that looks at business and financial modeling, that looks at run rates of revenue and cash, because we have to think that way. We are a not-for-profit, but we are also a very large business that has a lot of moving parts. And because of the integration of the agency system, it can be very complicated. So we looked at that, and then of course, resource development needs, and putting different mechanisms in place to reach out to the community, and then adjusting the information, making those changes in real time. And we also did some things that, again, that businesses, not-for-profits, had to do at this time. Reductions in compensation, executive management all took significant reductions, as did the agency executives. We renegotiated contracts. We didn't need parking services anymore. We didn't need catering services. We didn't need a multitude of things that we were able to make sure that we were moving money and interest from one area to another. So it continues to evolve, but I cannot say enough about the agencies and how we have worked together in making sure that we're problem solving, that we're shedding our institutional boundaries in recognition that we have a mission to serve people and to help them at this very difficult time.
So, Mark, talk a little bit about the agencies themselves. You fund a lot of programs. Talk a little bit about the special things that those agencies are doing, or wherever you feel comfortable sharing at this point.
For example, Scott, and quite a bit has changed. For example, people don't have food. In particular, it's impacting our elderly. So we have initiated with HI, one of our agencies, a mobile food pantry. We anticipate that we're going to be delivering 1,000 meals a week. So we're talking about taking things very much to scale. And there are going to be other initiatives like that. HANA, which is our response, our Jewish communal response to domestic violence and to elder abuse and things of that nature, they have put, and this is very important because there has been an uptick in cases of domestic violence. We have had people put into safe houses in order to protect human beings and families. We have had, and this is HANA's innovation, they put together a new chat feature on their website so that people, when they can't speak on the phone, if their abuser is in the house, they can access the website and be able to get information and let people know that they're in trouble. So we've had upticks in unemployment. We've got upticks in a need for emergency cash assistance. And then we have things of mental health services. We have Jewish Community Services are doing virtual therapy sessions. The JCC is doing wellness on Zoom. So we have had to adapt based on the circumstances and what we have in front of us in responding to the needs of the day. So the agencies have very much pivoted, Scott.
And how's the staff doing?
Okay, so another deep sigh. Yeah, in terms of how the staff is doing, first let me say I couldn't be prouder of them and what they do. That fortunately we have people who are incredibly mission driven. So their attitude and their resilience has been rather high. Now, with that said, balancing responsibilities, work, home, family. As a matter of fact, Scott, as a healthcare professional, you can appreciate this, and everybody can that's on this call. By the way, I'm also getting texts from people that are watching on Facebook.
That's a good thing.
They're balancing. Now, the healthcare professional piece of it is when you read about 60,000 deaths and you read about the number of people in Maryland who are getting sick and have to go into ICUs, it's numbers. But as we know, these numbers are people. And now the staff is being confronted with having people in their own families, or in some cases themselves, that have the virus and are battling against this horrible virus. So it takes even more of a human toll on individuals. So the stress of work and pressure and all those things, and quite frankly, also the unknown, because we know what we know today, but the dynamics are changing so quickly that we are spending time at informing staff, letting them know what's going on, being very transparent, and not trying to be doom and gloom, but trying to be realistic, and also recognizing that we're serving people, just as you're seeing the trauma of the frontline workers in New York and other places. Our people they're tired and they need to replenish, and we're telling them, you need to get your rest, you need to take some downtime. It's been like 16 to 18-hour days. It's been, as I said, it's been rather crazy, but they're a resilient bunch, and they're doing very well, or dealing with the circumstances at hand.
So Mark, first let me point out, Mark, thank you. That's a great answer. Let me make sure that folks watching the show know that they can type in questions, and our wonderful moderator, Jonathan Olieski, will then ask those questions on your behalf. And Mark and the team are open to whatever questions. You mentioned about how the frontline people have to take care of themselves. It's very true. I had a difficult conversation with my son the other day, and some of you have noticed last time I mentioned my son is one of the physicians in an ICU in New York City at Columbia Presbyterian, where the head of the emergency room committed suicide last week. And I had a long talk with him about PTSD and about stress and about depression and all those sorts of things that all of these workers, including your staff that's dealing with this right on the front lines, has to be aware of, because it's a real issue, and we don't want to lose the staff people either, not just the patients. But we have staff people that can become patients very quickly. So I appreciate you asking that. So where do you go from here? I mean, it's awful, and it's unclear, as you mentioned. Are we going to be in lockdown for a month? Are we going to be in lockdown till September? Are we going to be, if you're high risk, in a lockdown situation until there's a vaccine? Some folks are very high risk and may choose to be essentially on lockdown. How does that affect the way you look at the services that Associated has to be prepared to provide?
Well, I think for the near term, I don't have a crystal ball on exactly when we're going to reopen facilities, but I can share with you, already we made determinations, things that are mundane, in the context of what we're talking about, like annual meetings. We have one at the end of June. It's going to be virtual. We don't foresee having many events into the fall. Missions to Israel, travel to Israel, it's not going to happen in an organized way until at least 2021. So in terms of provision of services to people who need help, like therapeutic services, safe houses, food, we're going to have to continue to use good judgment in making sure that we can get the services needed without putting personnel at risk. So again, in terms of proximity, you have to be able to deliver food. You have to go out. In terms of therapy, some people you need to see in person. Some people you can see virtually. There are other things that we're going to need to do in person, but I can see for at least the next month that we are doing the bulk of what we do virtually, and we're going to evaluate. But even then, it's going to be a new normal. We talked about when we do open up, what does it look like? Do agencies, and the answer is probably yes, have screens for temperature and restrictions on you need to ask, you need to wear masks, and maybe alternating personnel so that we don't have too many people in our buildings. But what does it mean for places like the JCC for gatherings and for workouts? It's still a lot of unknowns. So we're paying attention, listening to the authorities, having ongoing conversations with the feds, with the state, with the medical experts, and we're basically evaluating. I have to tell you, Scott, somebody who you know very well, who actually went to Israel with you and me, and it's kind of surreal. Yom Ha'atzmaut was yesterday. I was a few years back in Israel with Scott during Yom Ha'atzmaut. How different that we marked that special day the way that we did this year, virtually in Zoom rooms and chats and whatever, and not be able to be out there and doing. So I think we're going to play this whole thing by ear. What that person said, who is that a long-term plan in this environment is 3 days maximum.
Yeah.
And then you're always kind of adjusting.
Mark, you touched on a few things that I'm sure the audience wants to know more about. The first is that many people have heard that we did furlough people at our JCCs. So if you would just comment a little on what happened there.
Okay, another deep sigh. So we have tried from the very beginning, and I have to tell you, when you talk about volunteers and professionals and expertise and what they bring to the table, we have engaged bankers, heads of finance departments, people running their own businesses, medical experts, HR professionals, insurance and risk management professionals, communications professionals. We've engaged them all. The operative, right from the start, was to have little to zero disruption. However, it became very clear that this was a disruptive moment, and we were going to have to adapt. So in the case of the JCC, they were particularly hard hit because their revenue model is predicated on people visiting. It's very much kind of like a retail operation. So when it was clear to the leadership of the JCC and the associated that the run rate of going through cash was so aggressive that there had to be a lever that was pulled in order to slow things down. The only option that we had was, if we wanted to continue to provide service, continue to keep foundational issues intact across the agency system, we were going to have to go to furlough on that agency. Another thing kind of complicated it when out of our 11 applications for small business loan funding on the first round, no fault of anybody's, we only received 3, and then the money was gone. So again, we didn't want to have to do that. As a matter of fact, these are our friends, our family. This is a family, and that was a very difficult decision to make. And I would be less than honest if I didn't say that the PPPs, the small business loans, are not a panacea. It's a short-term fix or response, but it's not a long-term solution. There is going to need to be more or less what we are referring to as a new normal. So, yes.
Mark, Jonathan here. I have a question for you from Howard in Baltimore, who would like to know what the Associated is doing for the city at large beyond Jewish Baltimore during this crisis.
Okay, so all the agencies that we have, every one of them has a footprint in the city of Baltimore. So, for example, the Pearlstone Center has been delivering meals for people who are on the first line of defense, for fire, police, medical. The Jewish Volunteer Connection has been deploying volunteers for highest and best use in the city and around in environs. So we have been working in collaboratives with our agencies and with other agencies of making sure that we're shedding our organizational skin to the extent we can and responding to the issues of the day. In terms of how we're oriented also by obligation, by sanction, by charter, we work directly with our local agencies. Their reach is into the city and our own community and beyond. In Israel, even though right now we are laser-like focused on Baltimore, because right now we have to address Baltimore issues. We don't have a government of the Jewish community of Baltimore. I guess by extension, kind of like a quasi, structure is the associated system. So we're responding to the things that we need to and serving the whole community. Anybody who seeks help, or in instances when we go into the city, everybody is the recipient of Jewish community largesse.
So Mark, it's
And
easy
could you,
for-
I'm sorry.
No, go ahead, please.
I just wanted to know, since we're talking about that, whether it's the city or what the communal response is, how can people who are on this, now, this watching us live or will watch us following up, can you help us, tell us some ways that everybody in the community could somehow help?
Sure, excuse me. I think the simplest way to say it, it's probably in a few different areas. One is being kind and being supportive. Again, right now people are dealing with a volume of stuff. People who are battling the virus, people who are on the Zoom call, that are on Facebook, that are texting me and saying that they've been serviced by this agency or that agency, and how wonderful to have a safety net or whatever it might be. I think being kind and being supportive of one another is one very important thing. To give you an idea of one story, we early on, because we have alternative living units for people with special needs, and when we saw the highly contagious nature of the virus, and we started to learn more and more about it, and the need for something I never heard about, PPE, protective equipment, that we needed this. We called area hospitals, we couldn't get it. And then there was an individual who had access to PPEs. We called him, and all of a sudden we had thermometers, gowns, gloves, masks, so those types of things, or people that were schlepping food or making face masks for people to be able to use. So giving of time, treasure, and by that I mean money, because of course we need volunteers and we need people to be kind. But the stuff, the community that we want, and the vitality and the responsiveness requires, Baltimoreans know this, because per capita Baltimoreans are amongst the Jewish community amongst the most generous in the nation. If we want it, we're going to have to make that happen. So we can innovate, and then we have to be able to pay for it. So right now it's being responsive to our unified campaign of where we're dealing with the issues and by extension our responses. There is, Beth, which on this next Tuesday, on I guess it's on May the 5th, there's a national initiative called Givingtuesday. We have it's a national initiative of giving. The Associated is participating on behalf of our network in the Jewish community and others that we serve who are not Jewish. There is a group of Baltimore Associated donors who have put up a matching challenge grant that between now and May 8th, and the reason that they did it between now and May 8th is that Giving Tuesday is on Tuesday, May 5th. It's over on May 8th. They're trying to incent people to give now, and that every gift will be matched dollar for dollar and go immediately to those who need assistance. Again, it comes in, we understand what the highest and best use and priorities are, and we go and we attack those issues. So it's kindness, giving of time, giving of money, and just being supportive. And there's another area which you also know well. the power of social media. So Scott Rifkin, Yasher Koach to you, that here by having something like this, again, people on Facebook, people online, people can understand the power and utility and efficacy of having a collective system and how individuals and families can affect that system. So something like this. We also have young adults who are producing their own in-house videos, sending it out to their networks, encouraging people to participate, and they're making gifts online, or people sending emails to their networks. I think in every respect, this is where our system, the value of being positioned and structured the way we are, back to an earlier question, shines, because we're not competing with one another. We're working holistically together, weeding out the redundancy that may exist in other systems. So right now, we just need your help. We just need you.
So Mark, I was about to ask you where you found hope in all of this. I think you just answered the question. So I'm not going to ask you that question again, but clearly you just talked a lot about folks that are just stepping up and bringing hope to the community. And this will get better with time. I noticed that you said in the beginning that you've never heard of personal protective equipment. I always thought that was something my baseball coach made sure I was wearing if I was going to be the catcher that day. No, I didn't know what it was. And I'm a physician. I didn't know what they meant by that at first. But look, there really is hope in there. And the fact that people are stepping up and helping Associated and helping the mission of Associated is really, really important. I think I'm going to let Beth ask the last question, and then Beth and I will probably want to give the audience a little bit of heads up on the kind of shows we're going to be putting on in the future. And then we'll turn it over to Jonathan after that. Does that sound good, Jonathan?
Sure.
Good. Beth, you get to ask the last question.
Oh, well, first of all, I just want to say thank you, Mark, so much for being here. I know how busy you are. So let me just ask you, I'm turning it over to you, Mark Terrill. What else would you like to share?
I guess, as Scott said, there will be a day then when we can look back on this and have memories, good and bad, and we'll get beyond this. So I think it's just continuing to approach what we're doing with optimism, with a resolute manner, and with rigor. And if you think about the history of the Jewish people, this is not a big deal. It's a big deal, but it's not the worst thing that we've dealt with. We've dealt with a lot of horrible things, and we always come out and emerge stronger. And when I watch videos of Israel's birthday, 72 years young, and I see an air show, again, you have, thinking about the Shoah, and now you have an Israeli Air Force, and you have an F-15I screeching across the sky with a Mogen David on the tail. We've come a long way. So this too will pass. We're going to be fine, and we need to work together.
Mark, thank you so much for being here today. I know Beth feels the same way and just said so. A couple quick comments to the audience. We're always looking for input on what kind of shows to put on. In the near future, and I don't have exact dates yet, we'll be bringing some of the resources from Associated, and I'll let Beth comment more on that. We may very well have frontline providers, whether they're healthcare or the people delivering our groceries or the people doing all the little things it takes that have to go to work every day and have to leave their home and are taking risk every day. Put them on the air. Another show that I think we're trying to set up, and we'll get dates to everybody pretty quickly, is the nursing homes. The deaths in the nursing homes, you saw it all over the newspaper today. You saw it in the Washington press conference today. The nursing homes are just getting clobbered by this. And a lot of our listeners or watchers are going to have family members affected by that. So we'll be putting on a show in regard to the nursing homes, get the administrators, the nurses, the doctors that work in these facilities, the public health people onto a show. Beth, do you have anything you want to comment on?
Well, first of all, again, I want to thank Mark. I also want to thank everyone at the Associated, all the agencies around town for what the incredible work that is being done to move our community forward. I can tell you that on Tuesday, Scott and I will be hosting at noon another Upside, and our guest will be Joan Grayson Cohen. Joan is the Executive Director of Jewish Community Services, and she's going to be discussing staying connected and preventing isolation during these days of confinement. Also, as Mark said, on May 5th, it is a day of community unity and giving, and if you want to donate your gift now, we have a match happening, so you can double your gift by going online to associated.org/givingtuesday-now. And I would just say, remember, you can visit us always at associated.org and jmoreliving.com for more information and stories and resources.
Jonathan, it's all yours.
Well, thank you all for joining us for our second show. Everyone be safe, spend good time with your families, Shabbat Shalom, and we will see you next Tuesday at noon. Be well.
Thank you.
Yeah.